Hi, I'm Stephanie, the PT, and together with Nicole, the OT, we make up the Note Ninjas. We teach other therapists documentation tips and treatment ideas. So today I am going to talk about how to get your documentation done quickly. I think a major cause of burnout in our profession is that the productivity and also the documentation. We don't want to be staying after hours to document. And we want to be treating our patients. We don't want to be typing the whole time. So what we do is we have templates or documentation banks. So on my computer in a Google Doc, I have some documentation banks. So if I am doing transfers with a patient and they are presenting with retropulsion, I will have a bank for maybe 20 different ways our patient could be presenting. I'll copy and paste retropulsion into my notes. And then what did I do about it? Did I have an external cue? Did I give a verbal cue? Did they need physical assist to bend their knees back more? I would have all of these different ways my patient could present in a documentation bank. So I would just go in and then I could copy and paste it into my notes. But it's still patient specific because I might have 10 or 20 verbal cues, 10 or 20 tactile. And it's basically any way my patient could present. And over time, I built up this documentation bank. So there's just so many ideas. And besides it helping with my documentation quickly, if I have that patient that I'm just continually trying to get them to transfer and they just keep falling back or there's some kind of issue or an ADL and they just can't seem to get it, I will go to this documentation bank and look at my cues and be like, oh, maybe this is what I could do. Maybe this verbal cue will do it. Maybe this external cue will do it. And then all of a sudden, my patient might get better because it just slips your mind. We work all day. We've worked maybe for a few years, and sometimes we just forget about different techniques that could possibly work. So besides documentation quicker, it also helps us treat our patients. So we can avoid burnout. We can help our patients reach their goals. So you could just set this up on a Google Doc, on a Words document. And, it took us many years to get to this point, but over time, you could have all of these ideas and you can get them quickly, on time, and with major success. And if you want our documentation banks, you should check out the Note Ninjas. We have a whole section on documentation banks for every kind of functional activity and impairment our patients present with. We've done all the work for you, so you don't have to. So make sure to check out the Note Ninja membership. There's a link below, and also follow the Note Ninjas for more treatment ideas and documentation tips.